Hello, and welcome to CMS's conference on optimizing healthcare delivery to improve patient lives. I am John Blum, Principal Deputy and Chief Operating Officer for the Centers for Medicare and Medicaid Services. Thank you for being here today. Too often, burden is a factor in limiting access for patients to their healthcare delivery here in the U.S. Whether it is too many forms, unnecessary documentation, or outdated requirements, it all creates a strain on the healthcare delivery system. This can result in repeat visits to the lab, to the pharmacy, delays in getting care, and missing medications, all of which waste time, effort, and money. Together, this burden can drive inequities in care and in healthcare outcomes, which can prevent or discourage people from receiving care at all. This is a challenge looming over the lives of patients, caregivers, and our country's dedicated healthcare professionals. We are living in a time of incredible promise with remarkable changes in technologies, which are providing connections to care with a focus on including the underheard and underserved populations. With all the challenges here in front of us, there is much reason for optimism. A major outcome I hope we will see from this conference is to advance the conversation on how to reduce burden and how to best acknowledge and focus the roles we each have in making strides together to improve the overall experience of receiving and delivering healthcare. We know that disparities in health and healthcare persist despite decades of research and widespread efforts to improve health outcomes here in the U.S. Certain populations, including those who experience racial disparity, people with disabilities, those who are duly eligible for Medicare and Medicaid, and those living in rural and underserved areas are more likely to experience challenges accessing healthcare services, lower quality of care, and below average health outcomes when compared to the general population. A 2021 study by Health Service Research found 25% of patients delayed or foregone care due to too many burdens. Many of you know firsthand our country's healthcare workforce is under tremendous strain. A study from the Mayo Clinic found 63% of physicians practicing in the United States experienced at least one manifestation of burnout. A Bain & Company study found 25% of U.S. clinicians admitted they were contemplating changing careers, with a staggering 89% citing burnout as their primary reason. This is unacceptable. As Surgeon General Vivek Murthy pointed out in his 2022 advisory on building a thriving health workforce, we have a moral obligation to address the long-standing crisis of burnout, exhaustion, and moral distress across the health community. Our healthcare system simply cannot function without a healthy, engaged, and thriving clinicians. CMS is fully committed to identifying and addressing avoidable burdens in the healthcare delivery system. You will hear more in a few minutes regarding numerous policies and initiatives already underway at CMS, which we think will lead to real improvements. We are working to simplify the prior authorization process and to reduce potential disruptions in care that may occur because of complex prior authorization requirements. We've issued proposed rules that would continue to advance our agency's interoperability goals, which means enabling healthcare data to flow more freely and securely between payers, providers, and patients, creating a more connected healthcare system. We are addressing the burden associated with exchanging documentation to support healthcare claims, which for many is completed via physical mail, fax, or dedicated web portals, by proposing standards to support healthcare attachments, transactions, and standards for e-signatures. We recently saw comment on the concept of CMS creating a national directory with information on healthcare providers, payers, and other services. And through our Universal Foundations initiative, we aim to streamline quality measures across CMS programs. We hope this will focus provider attention, identify disparities in care, prioritize development of interoperable digital quality measures, allow for cross comparisons across CMS programs, and help identify measurement gaps. Together, our hope is these changes will have the effect of giving back time to clinicians, time they can spend on the work and care they have dedicated their lives to providing. CMS is committed to improving customer experience by identifying issues and root causes that impact health equity, healthcare delivery, access to services, inefficiencies, and burden experienced by providers and patients to ensure the customer perspective is in CMS's policy writing and operational work. Whether it is your response to a request for information, a survey, coming to a conference like this, we value your feedback. We recognize too much burden, too many tasks, and care disruptions can impact patients and healthcare professionals. Patients, caregivers, and clinicians deserve an equitable and efficient healthcare system, which focuses on the exceptional care our nation needs and deserves. CMS's commitment to addressing these issues is not just a policy initiative, but a transformative step in reshaping the healthcare landscape. This commitment underscores the agency's dedication to enhancing the lives of patients, caregivers, and healthcare professionals, ensuring healthcare resolves around healing rather than hurdles. I thank you for taking the time to be here today. I extend deep gratitude to all the exceptional speakers who have given their time to this effort. I hope you find value here in these discussions, as well as actionable information you can take back to your workplace. By working together, we can build a future where healthcare is meaningful, patient-focused, and beneficial to all stakeholders. Thank you.